Hi everyone, this is my presentation of HIV and AIDS. I'm Mackenzie Welliver and I'm going to be giving you some more information. Just to start off, for the classification in the description, HIV, also known as human immunodeficiency virus, attacks the human immune system and, unlike other viruses, does not have a cure. HIV is gram-positive, roughly with a diameter from 100 to 120 nanometers, and the capsid is made of P24 protein. HIV is an enveloped virus, meaning it protects the genetic material in their life cycle when traveling between host cells and the outer wrapping that encircles that protein coat. HIV is an RNA virus with 2 single-stranded RNAs, and once inside, HIV's RNA is reverse transcribed into DNA. As for the disease description, the areas infected are primarily the immune system and specifically targeting CD4 plus T cells and others. Some of the signs and symptoms. For the acute phase, the flu-like symptoms such as fever, sore throat, rash, muscle aches, and swollen lymph nodes occur, and you start to notice them sooner on, although a lot of people do get them kind of mixed up with actual flu-like symptoms, and it takes a little bit to actually go in and get tested for anything. But for the chronic phase, they're more than mild symptoms, but they progress into the immune system, and then it occurs damage, and is when you really start to realize. Since there is no cure, taking medication does help your symptoms, but once HIV is in your bloodstream, you can never necessarily get it out of your bloodstream. Which AIDS development typically occurs 8 to 10 years after the initial infection if left untreated, which is characterized by severe immune suppression leading to opportunistic infections like pneumonia and other stuff like that. The incubation period in the beginning is 2 to 4 weeks after exposure, and then, like I said before, the AIDS development typically occurs 8 to 10 years after the initial infection, if untreated. But do keep in mind that there is exactly no cure for HIV. As of right now, they are working on it, but there is not one. So you can just take medication that helps your symptoms and lessens the increase of risk. As for risk factors, some of the risk factors from transmitting the disease from one person to another is unprotected sexual contact. So engaging in vaginal, anal, or oral sex is a huge risk factor, which is why it's important to wear condoms and have protection from things like that, especially with unprotected sexual contact with people you may not know everything about, because it is very easy to transmit HIV from one person to another in that setting. As well, sharing needles or syringes, like injecting drugs, tattoos, and piercings, which is why it's really important that at tattoo places they are cleaning those needles and changing those needles, because it is really, really easy to get the contaminated blood on that and give it to one person straight to another. Another big one is mother-to-child transfusion, which happens during pregnancy, birth, or breastfeeding. Basically, when you get pregnant, it's really high chance that you are gonna give that disease to your baby, which usually happens early on during pregnancy, and you realize you test them at birth. As for blood transfusion and organ transplants, contaminated blood again, if you get a organ from someone that had HIV and you give an organ transplant to that person, you will be giving them HIV. Another thing to keep in mind is sexually transmitted infections. So having another transmitted disease can increase your risk for HIV. But occupational exposure is also one. Healthcare workers and substance abuse, those are huge ones. It's super important to take the correct protection and care when working in those environments. Keep in mind, though, HIV is highly contagious when in contact with it, and it is very important to take the correct cautions to avoid this. Disease frequency. So the specific regions HIV and AIDS are in, it is a global virus, but it has the highest impact in other areas that is not America, and the highest rates are also seen in regions of Asia, Latin America, and Eastern Europe. The susceptible individuals at high risk are groups including men who have sex with other men, also known as MSM, and then drug users, sex workers, and individuals in regions with high HIV prevalence. So it's super important to keep that in mind. Mortality rates as of 2023, approximately 38 million people are living with HIV globally, with around 1.7 million new infections and 690,000 deaths annually. So HIV is super important to know about because so many people in America and globally around the world are living with it daily, and it is a very high risk factor of death. So for source and transmission, human carriers, HIV is primarily found in human carriers, and the virus does not have a non-human or environmental reservoir. Person to person, HIV is transmitted through direct contact with certain body fluids, including blood, semen, vaginal fluids, rectal fluids, and breast milk. So again, just taking that extra precaution for when you're having sexual contact or getting piercings, or even if you are trying to have babies, just getting that extra protection and that caution of going through and having those tests of HIV. The common transmission routes, again, sexual contact, sharing needles or syringes, breastfeeding. I think those are kind of just the biggest ones that happen. Again, prevention, safe sex, condom use, pre-exposure, needle exchange programs, just stuff like that for women. There's also ART for pregnant women, which I'm going to get into on the next slide. So for the therapy, the ART, it involves a combination of drugs that inhabits various stages of the HIV life cycle, including reverse transcription, integration, and protease processing. So no fully effective vaccine exists though research continues, and some vaccines are in trial stages. So they're doing those trials to see if it helps with HIV, but as of right now in 2024, there is no cure. HIV infection does not confer lasting immunity, and the virus can persist in a latent form, making it difficult to eradicate. There is multiple key drug classes that can help with this disease, although again, there is no cure. As for tests, there's a lot of common laboratory methods, serology tests, nucleic acid tests, CD4 counts, viral load tests, all these types of tests to kind of help with understanding if you have it and just understanding the disease more. Some other information about HIV. HIV can enter a latent state in resting CD4 plus T cells where it remains dormant and undetectable by the immune system. It's a major barrier to curing HIV for sure. Besides blood, HIV can reside in lymph nodes, the brain, and genital tract tissues, complicating treatment and eradication efforts. Progressive loss of CD4 plus T cells weakens the immune system, leading to the opportunistic infections and cancers characteristics of AIDS. So this is if untreated. Again, like I said earlier on, 8 to 10 years after is when the AIDS actually starts to form from HIV to AIDS. For social and economic risk factors, this is a huge one for people living with HIV, especially considering the fact that there's so many people globally living with it. A lot of people deal with stigma and discrimination and social isolation, which can just hinder access to care and support for them. It's an economic burden. HIV and AIDS imposes significant economic costs on individuals and societies, including healthcare expenses, loss of productivity, and the burden on healthcare systems, especially in heavily affected regions like the sub-Saharan African. So, for social and economic risk factors, it is very huge. For global response, international organizations like UNAIDS and the World Health Organization, WHO, they're trying to combat promoting prevention, treatment, and education on HIV to decrease some of these globally impacted HIV carriers. As for that is my presentation. Thank you so much for watching. Hopefully this strengthens your, goodbye.